Hello and welcome to the Surgical Spirit podcast. I'm your host, Dr. Haidar Al-Hakim, the Third Eye Doctor. Pull up a chair and get ready for some candid and uncompromising discussion with experts, innovators, agitators, and influential people from every corner of health and well-being. From inside the hospital to at home in the kitchen, we're leaving no stone unturned in our quest to uncover the secrets of healthier, happier, more successful, and less stressful lives. Thank you so much for joining us, and without further ado, let's meet this episode's guest. Hello and welcome to the Surgical Spirit podcast. This is Dr. Haidar Al-Hakim, the Third Eye Doctor. Thanks for listening today. And we have Dr. Shan Hussain with us. Hello, Shan.
Hi, Haidar. How are you?
Yes, I'm very well. I'm not very well, actually. I'm quite hot and flustered with this current heat wave. But, you know, we love to complain about the weather, don't we, as Brits?
Yes, I guess a lot of us do, but I'm just making the most of it. This is a glorious summer we're experiencing, and I can't remember it ever being this pleasant here in the UK.
Yeah,
so.
really, really hot. I remember one time I was an SHO in the Royal Free, and it got to about 40 degrees. This was 2003, I think. And it wasn't nice, I must say. There was no aircon in the hospital, and yeah, it was quite a difficult time to work in. And going home and trying to sleep with no aircon. Do you have aircon in your home?
No, we don't. No, I don't think we can justify it, given how infrequent these hot days are.
Cool. So you've done quite a lot in your career. I mean, tell us about. I mean, we actually qualified the same year in 1999. I was at Barts in London.
That's correct. Yes, I was at Imperial in London, a little bit west of you, but yes,
we were kind of enemies. We're kind of enemies, you know.
Well, maybe friendly rivals, let's say. I don't think there was any doubt which was the superior medical school, but let's not get into that.
Thanks for mentioning, superior. Yes.
Very good.
Cool. So, so you're based in Nottingham. Did you grow up in Nottingham?
Yes, born and bred here in Nottingham, and I lived here for my first 19 years, and then went to London the same time as you, back in 94, and graduated in 99. Came back here probably a year or so later, and I've stayed here ever since. It's my hometown. I love it here, and I've got my friends and family here, so very happy and settled here.
I sense that sort of London was it difficult studying there, working there? What was it like?
I loved being in London. I didn't particularly enjoy the medical school experience, but being in London was fantastic. You know, with 7 million people, such a vibrant place to be, and always exciting things going on, stuff to do. I used to really enjoy taking in shows, concerts. All the great artists of our time would always come to London. They wouldn't bother about towns like Nottingham, unfortunately. So I really enjoyed it. It was very very just a wonderful place to be.
So the London life compensated for the interesting experience in medical school.
I think from what we've previously been talking about, we had quite similar experiences as to what we went through in medical school. It was very traditional, the education we had, very serious, very unforgiving, and the approach we had from professors and from hospital doctors was well, we were talking about this a moment ago. Clearly they've changed the approach now in much more of a supportive way, where individual students' needs are met and they're taken care of at an emotional level, and they have robust systems in place to make sure that emotional well-being is taken care of. There was none of that in my day, or at least none that we were consciously made aware of, which was a little disappointing. And it could be quite a lonely time and a very stressful time. I've not come across anything as demanding as the experience I had in medical school at academic level. The teaching was variable, should we say, but most of it was self-directed learning.
Yes.
And that kept us busy. But it got me also into a good habit in terms of continuing that self-direction and expanding learning beyond the traditional medical school, looking more into health and wellness, and what we really need to do to achieve these kind of optimal levels of health that I try and encourage people to take on board, the kind of things that we don't really learn in medical school.
When did you start looking into that? Was it sort of before medical school, during medical school, after?
It was mostly afterwards. I sort of started to look at things that, more in terms of what we want in terms of our health rather than what we need. What we often look at is that doctors are great at helping people with illness, but in terms of really helping people achieve optimal health, where they have energy and well-being and vitality, and they're able to perform at their optimal levels, that's not something that modern medicine really teaches. But I feel that's something that a lot of people need, and that's what got me interested in that. How can we work to help people in those situations? Most people aren't really ill enough to see a doctor, but they also don't have that level of health and energy and wellness about them. And my approach really is to try and help those people who really want to step up to that level and get themselves in a position where they feel they're in a much stronger position to serve, whether it's their business or their clients or their family.
Was there a particular experience that sort of allowed you to look into this aspect?
There was, yes. It was one particular day actually in practice, probably about 6 or 7 years ago now, where I was working. I was a qualified GP and working in my own practice. And that morning, it was a Monday morning, I'd seen almost 50 patients.
Wow.
As you know, each patient comes in with an average of 2.7 problems. So, it was an incredibly busy morning. And by lunchtime, I was just physically, emotionally drained. I felt like I had nothing left, and I still had the rest of the day to go. And I just took a few deep breaths and sat back and just had to think about, what I'd just been through, and looked at all the patients that I'd seen, quickly reviewed my notes, and I realized that almost 80% of the cases I'd seen were people presenting with lifestyle conditions, problems directly related to their diets or lifestyle, or how they were engaging or approaching their professions or relationships, and everything seemed to build from there, leading to illness. And so I thought, well, what's the best approach to teach to help these people? Is it always going to be about pills and potions and counseling and psychotherapy? Is that the only way? And I realized that lifestyle problems obviously also need lifestyle solutions, and there are a lot of things that we can do that are scientifically backed that help address many of the problems that we all face day to day, that can potentially reduce the amount of demand that is being made on healthcare professionals at what are incredibly busy times. So I started to look at that and really accumulate everything I could. We all know that we need to eat well and exercise and stop smoking and not drink so much alcohol. That's the common sense stuff. What else is there? What more can we do? And where's the science to back it? And how powerful is it? And so in my research, well, not my personal research, but looking into the research papers that are available, found out some incredible things about health and wellness, and all related to a natural approach. So I decided to bring it all together and write a book about it, which I got published early last year, to really present a nice sort of clean summary of all the things that we could potentially do that can actually support our health without pills and potions and doctors and nurses. And so that got published in January last year, and it did rather well. It became a bestseller on Amazon.
Wow.
Here in the UK, US, Canada, Australia, and it's been well received. So yes, that's led to further inquiries about my work. I've been doing a lot of writing, a few speaking engagements, and really doing everything I can to get this message out there about how we also need to approach health and wellness naturally. Yes, absolutely. Doctors have their, have their role, and medications have their place. At the same time, we've also got to look at the underlying cause in these situations and how we can help address that.
It's interesting that you mentioned your previous teachers being hospital doctors. Was that the reason why you went into GPs, because you found better teachers in general practice, or was it you've always wanted to become a GP, or how did it work out?
I didn't enjoy the undergraduate hospital medicine approach, but when I got into hospital medicine as a postgraduate, I actually enjoyed it very much on the whole. I was in hospital medicine for 7 years. I did lots of different specialties, 3 years in casualty, pediatrics, medicine, general surgery, orthopedics, obstetrics, gynae, and yes, I enjoyed it very much. I don't think there was a situation where I would compare the teaching of hospital to general practice, or whether one was better than the other. It was very individual. It depended on the teacher and on the approach and the style of that teaching that we received. You know, the old Chinese saying, "There's no such thing as a bad student, only a bad teacher," is one that I really do feel is true. So I think ultimately what brought me into general practice was how we managed to be able to look at pretty much everything that came in. Literally anything that walks through the door, we've got to have an understanding as to how we can help that person. You know, if someone collapses on the street, we've got to know what to do. You know, I was on a flight last year from the Philippines, and they made that dread announcement over the tannoy: "Is there a doctor on board?" Yes, and you know, I had to identify myself, and you know, fortunately, with my training and with my knowledge, I knew what to do to help that person. We managed to help him and to land safely on time.
Well, so, yes, I mean, I'm sure I'm excluded because I'm an eye doctor, you know, unless you've got an eye emergency. Otherwise, I'm staying quiet. Well,
I'm sure you have your basic training, and it's amazing how quickly some of these things come back to you when they need to.
Oh dear. Yeah, I mean, you teach a lot. You know, I was going to say teach your clients, but sort of coaching is different from teaching. I mean, what would you say a good teacher is being about in your eyes?
Understand the needs of the student, really. Really connecting and understanding the needs of the student, and having a good approach and a good style, which is totally honest and transparent. It's interesting you said that. I had a school reunion recently. One of my friends, one of my best friends, who I hadn't seen for a few years, he's now a teacher, a French teacher.
Wow.
Which I found quite amusing, because he was you know, quite boisterous in lessons, and you know, sometimes difficult to manage, and so I had to ask him this question: you know, how would you manage a student like you? And he had a very, very simple answer, and he just said, it's really, really simple. You know, just don't be an idiot, because kids are really smart. He didn't say idiot, just to be clear. He says something a little bit more offensive, but kids are really smart. They can see a teacher for what they are, and you know, they can pick up on behaviors they don't like or don't resonate with them, and you know, if they see that, then they will reject your teachings. They won't have any interest or any time for you, and you know, so I think it's about building that relationship, and you know, nurturing it, and making sure there's trust, that you're totally honest, transparent, with a genuine desire to help people.
Yeah, I mean, the teachers that I remember that influenced me are the ones, as you said, resonated with me, or people that I connected with on a human level. And once I developed that human connection and trust, you pretty much believe whatever they say, essentially.
Yeah. And
that's them imparting their knowledge rather than... and it's the same thing when you're sort of giving talks and in speaking engagement. It's that connection. You know, because it's easy to deliver a message. You know, that comes across very quickly, but it's what are they going to do with that message, or what are they going to do with that teaching? Yes, I totally agree. And in terms of your teachers in medicine in general, who was your biggest influence?
Do you mean like hospital doctors or general practitioners?
well, there's no distinction. I'm sure. I'm sure it's pretty amalgamated, or I could be wrong.
Yeah, there was this one A&E consultant that I worked with, who I was actually just talking to my wife about today, who was just tremendous. And it wasn't as much his knowledge and his experience, but it was more to do with his presence, his physical presence. You know, if things were just going crazy and we were in the resus bay in casualty and everyone was just running around and you know, we're trying to help this patient who's clearly in a sort of life or death situation. And this gentleman would just need to walk into the room, and just having that presence, people would start to feel calm. And he wouldn't, you know, move people out of the way and say, you know, I'm the consultant, get out of the way. He would just gently approach the situation and, you know, take responsibility and, you know, support the team, ensure everyone knows what they're doing and everything. And it was really inspirational to learn from someone like that. Not just learning his knowledge and his wisdom, but also his mannerisms, his behavior, his style, his trait, his personality, his qualities, and you know, his character. So I think that he was probably the biggest influence that I had in terms of my professional approach. He had the most incredible bedside manner. Just looking at him, how he'd engage with patients, and you know, how he could talk and communicate with them and make them smile and reassure them and tell them, you know, it's going to be all right. Really sort of connecting with them, making time with them. These are the most valuable things that I learned about being a doctor. Much more powerful. And you're not going to get that kind of stuff from textbooks. You've got to go out and find the people who do it and spend time with them to really actually absorb their approach. So yes, I think that was my greatest influence. And I'm kind of saddened that these elements of being a doctor nowadays, they're not taught. You know, and I think they need to be. You know, the people need to have that education if they're not already doing it. I think nowadays there seems to be such a sort of bureaucratic, left-brained, box-ticking approach to medicine, which is unfortunately, well, some would argue fortunately, is probably going to be replaced by artificial intelligence very soon. So, you know, I really want to, well, I really hope that we can start to spread that authenticity back, and bring in the human element of caring and compassion for our patients.
Yeah, absolutely. I mean, my teacher, he was a rheumatology consultant while I was a house officer, and for him, it was humour. The thing that really got to me was his great humour in the most dire of situations. You know, all these chronic rheumatology patients who were inpatients and being given all these anti-inflammatories and anti-metabolites. And yet he brought humour onto the ward, and he brought, as you said, that human element to things. And you know, humour is very powerful because it sort of makes the you know, even the mundane enjoyable.
Absolutely, yes. Obviously, I think we do see a lot of dark humor in medicine and hospital practice now, which I don't necessarily agree with. You know, perhaps some humor arising from cynicism or sarcasm as to where things are right now and what's happening in the health service. But actually bringing that sort of happiness and joy with the kind of humor that you're sharing, yes, that's priceless.
Yeah, I mean, it was compassionate humour rather than, you know, the ironic. I mean, I still think that ironic humour and dark humour has a place in our situation and in our profession. And, you know, for me, when I wrote my book, I used a lot of dark and ironic humour and sarcastic humour because that's who I am. You know, I'm a very sarcastic person, which I used to use a lot previously. And I was a proper idiot, but now I've kind of embraced the diplomacy of situations rather than the sarcastic of situations. So yeah, humour is so powerful, and I think, I mean, for me, life is about humour and comedy. That way you can understand the contradictions in life and the paradoxes. But hey, let's not sort of go a bit too woo-woo. Yeah. I think, are we still there? Poor network connection. You still there, Shan?
I'm still here, yes.
Cool. Excellent. So, did you go through a bout of disillusionment or thinking to yourself, well, this sort of GP land is not really working for me?
Yes, I did. I did. It was actually about a year ago. It
Wow.
was so very recently. I think, referring to what I was talking about earlier, I mean, simplicity comes from the removal of obstacles, and there are a lot of organizations in place right now, such as NHSE, various CCGs, that are actually creating more obstacles for the delivery of healthcare, which is very, very frustrating for doctors. In terms of what we have to do, it's creating more and more unnecessary work that is actually taking us away from patient care. So yes, I became annoyed with that more than anything else, and I challenged it and I questioned it. And I think the real ironic thing was that all the GPs I spoke to completely agreed with me, but none of them are actually prepared to support me or back me or come with me to take the frustrations and the general irritations that were accumulating, to present them to the stakeholders who can actually do something about it. So that became, that in addition to an already difficult situation, that became even more disheartening and disillusioning. So yes, I think there are a lot of problems there, and I think there's a few different ways to describe it, whether it's learned helpfulness or willful blindness. But ultimately, I think doctors around the country need to remember that how much power they have right now, and how that is really being surrendered on a regular basis. These organizations, including the GMC, BMA, CCGs, CQC, NHS England, we don't work for them. They work for us. We need to remind ourselves of that every day, because ultimately, if every doctor on the planet decided to disengage with CQC, they would cease to exist. If every doctor on the planet or in the country said, you know what, GMC, you've hiked your fees up by 1,000% over the last 2 decades, and in exchange for what? To keep my name on a register. How can you justify that? And what are you doing to support us in these current situations? So yes, there are a lot of frustrations for doctors right now, but I think at the same time, doctors need to take a bit of responsibility about this and actually recognize that we're the ones who are agreeing to these things. We're the ones who are inviting a lot of this stress. What can we do about it? How can we fix it? I'm always open to discussing remedies to fixing it. I'm never open to sitting in a forum debating or arguing or complaining about how bad things are. Nobody wants to hear that. We all know how bad things are. How are we going to make things better? And I think probably the quickest way to do that will be to start to remove some of these ridiculous obstacles to care that have been put into place by senior managers and bureaucrats and doctors in high positions of responsibility who actually don't practice clinical medicine anymore.
So it's as simple as that.
Well, I think it's a good starting point.
Yeah.
I think we've got to remember that how can we possibly take care of 70 million people here in the UK if we're not really taking care of ourselves? If we're actually agreeing to all the stresses that are being put upon us. I mean, 20 years ago, people would see their GP on average twice a year, and now it's 7 times a year. And we haven't had a similar increase in funding, and at the same time, inflation has gone up. Our actual overall remuneration has gone down, and so we're working harder for less money. That's not taking us as far, and we're wondering why we're stressed. So I think solutions need to be made, or at least discussed at a high level here, instead of a lot of the rhetoric that we hear from the BMA, who are supposedly trying to represent doctors in terms of what's happening right now. I mean, I actually decided to take a break from the NHS in November. At the time, I decided I was leaving. I wasn't coming back, but in actual fact, I missed it greatly. But when I left,
why did you miss it?
Why did I miss it? I missed the one-on-one patient contact. I really missed working with patients as a doctor and helping people. I didn't miss any of the nonsense that came with it, but I recognized that I have to take care of that to meet the other need. But what was interesting was when I left, not one person asked me why I was leaving. Aside from my staff and my patients, there was no one within these high bureaucratic institutions who actually said, hang on, wait a second, we're losing doctors. Maybe we should sit down and talk to some of these doctors that are leaving and see if we can get an understanding as to why they're leaving. But nobody asked me, and I've had a number of friends leave. Nobody's asked them either. So, in the last year and a half, 2 years, we've lost 1,000 GPs. No one's asking why.
Wow.
And there seem to be various drives or campaigns to replace them, none of which are working. And at the same time, patient demand is going up, and greater demands are being made of doctors. It really is a situation that is in desperate need of help.
Yeah, you would have thought if a body's bleeding, you'd stop the bleeding and find out why it's bleeding.
Yes, I see. You're still a surgeon at heart, aren't you?
Well, yeah, it just makes no sense unless there's. I'm not a conspiracy theorist, but there must be other motives as to why they're looking into other avenues of replacing doctors.
Well, yes, I'm not a conspiracy theorist either, but I can't help thinking that there are people high up there with agendas. I sat on our LMC. I was invited to join our local medical committee, and I survived one meeting. I just had the most insufferable experience. There was a room full of about 20 or 30 GPs, majority of which stayed silent. It was largely about 4 GPs who were actually openly speaking, including Peter Holden, who was one of the, at the time, I don't know what he is now, but with the GPC. And it was just the most insufferable conversation, just this learned helplessness and willful blindness as to what's really going on. And I just thought to myself, what's going on? You all seem to be so terrified of upsetting the apple cart for fear of missing out on a future MBE. What is it that's making you have this ridiculous stance at the moment? Why aren't we doing things to make our lives easier for doctors and therefore for patients?
Yeah, I mean, having that sort of courage to stick your head out and say what's truly inside of you and what's causing the problems on the ground, is it a society problem, or is it sort of specific for doctors that we don't have enough courage of conviction?
I don't know if it's courage as such. I just think that if I don't say these things, it's gonna harm me. It's actually I have to push it down deep inside me. That's not going to be healthy. So coming out and actually saying things, not in an aggressive way, but with a deep desire to make things better for frontline NHS staff and for patients, and they're the only groups that I care about, really. I don't care about these organisations with their 3-letter acronyms that they're meaningless to me, and I only pay them if I have to. So I think that's really the outcome. How can we make lives better for frontline staff and for patients? What can we do to make things easier for us individually and collectively?
So you left the NHS. What did you do after that?
I took a break. It was the first time I've been away from the NHS or from any profession actually for 17, 18 years. Wow. And so I took a little break. I've been did a lot more writing and spent time with my family, and then decided to get back into it around about April time this year. And just been taking work that for places and for people that really resonate with me, rather than jumping back into the partnership model, which is increasingly looking flawed as they continuously unilaterally renegotiate the contracts without any prior discussion with general practitioners. So I decided I want to stay away from that model. I just don't feel it's sustainable, and it's heavily in favor of CCGs and not in favor of doctors or patients.
What did you write about during that period of rest?
I wrote about what I'm really passionate about, which is health and wellness, natural health and wellness, without medication, without doctors, without nurses. What we can do to help support that. I did a lot of writing for a few magazines, newspapers, just stuff that was interesting, that was topical. We had Mental Health Awareness Week in May. It was a very busy time writing about mental health from a primary care perspective. There were some interesting things that came up. There was a study I think in February this year that came up talking about depression and how pretty much concluding that most of us need to be on antidepressants, which was fundamentally flawed. And I can't believe it was actually published. It was a meta-analysis that included 45 unpublished articles that were taken directly from drug companies, and I thought, how can you include this and call it evidence? So I've done a lot of different things, and I've enjoyed it all very much.
Cool. And what was that when you wrote the book, The Big Prescription?
No, I actually wrote that while I was still working as a GP. So that sort of kept me busy in evenings and weekends, and so that came out in January 2017.
Right. How long did it take you to write the book?
I would say from beginning to end, about 15 months. Yeah.
And what was that like?
No, actually, it was less than that. I'm just thinking. So I started it. It was about 12 months, and then it took another 6 months to actually decide a title and a cover and everything, and then go through all of the publication process. So it was about 12 months of writing. What was that like? At the time, it was extremely difficult, very challenging, because I was a partner at a GP practice at the time, so I had those commitments as well. Very frustrating, but ultimately it was 100% worth it.
And if you can sort of tell us in a nutshell about the book and where they can get it from, and what's next in terms of your writing.
Well, yes. I mean, about the book, it really goes back to basic principles. Health, as you know, was defined as a state of complete physical, mental, and social well-being, not just the absence of disease or infirmity. And that was written into the World Health Organization's constitution back in 1948, just before the inception of the National Health Service. And it's a pretty powerful definition. It's remained unchallenged all this time. And the three areas that jumped out at me are complete physical well-being, complete mental well-being, and complete social well-being. Now, just as a disclaimer, I don't have that, and I don't know anyone who does, but it reveals an interesting approach as to what health really looks like. Complete health of the body, complete health of the mind, and complete health from the environment that we're placed in. And really building on those concepts, because as you know, the physical body, it's not a rigid structure. It's a fluid system in constant regeneration. You've got around about 40 trillion cells in your body right now that are constantly regenerating. As we're having this conversation right now, millions of your cells are dying and they're being replaced. So what can we do to support that constant regeneration in terms of our diet, our nutrients, our fluid intake, our activity levels? And then same with the mental well-being, the mind. We have an estimated 60,000 thoughts every day. What thoughts are we having? What are the continuous thoughts we're having? And what do they lead to in terms of our beliefs, in terms of our emotions and subsequent actions and results? And is this supporting our overall health, or is it potentially detrimental? And then how can we hack that? How can we engineer that? How can we have those kind of thoughts on a regular basis that actually take us towards health? And finally, social health, which I think is something that's going to start to get a lot of attention over the next 5 or 10 years, is really how and who we interact within our environment. So, any biology student will tell you that we are our genes placed in our environment, genes expressed within an environment. So you can take two identical twins, raise one in the UK and raise the other in, let's say, Australia. Bring them together at the age of 21, you'll have two completely different adults. They might look similar, but they'll be very different in terms of their attitudes, their beliefs, their behaviors, their approaches, their mannerisms, simply because they've been conditioned by the environment that they've been placed in. So what environmental factors are we currently experiencing that are influencing our health, and what can we do to address those? Whether it's, changing our environment itself, or at least changing our perception of the environment we're in that's creating the health that we have. A typical example, when I lived in London, I was probably more ill than any other time in my life. I was getting recurrent colds, I was very tired and drained a lot of the time. And then I moved home to Nottingham. It wasn't quite as bad. And now I live out in the countryside between Nottinghamshire, just by the Leicestershire border, beautiful green area. I don't fall ill anymore. Now, there could be a lot of other factors involved in that. I absolutely don't dispute that. But, just being out and having that sort of experience of, getting good clean air and come into contact with people within my neighborhood who are extremely warm and friendly and pleasant and engaging, which wasn't quite my experience with the neighbors I had in London. Can have a tremendous impact on how we feel, on our overall health. So they were the three areas that I was looked at. That's why the book is called Balancing the Three Principles of Enduring Health, because this is all about a balance. These three areas need to be in balance to support health. When we're out of balance, that is ultimately what leads to illness. Whether you're looking at heart disease, type 2 diabetes, hypertension, obesity, cancer, strokes, anxiety, depression, all come out of some kind of imbalance within our physical or mental or social well-being. If we get those areas back in balance, we can start to see some very real changes in those conditions and how they're being managed. It's no secret that whenever you see a doctor, if a doctor finds that you have high blood pressure that doesn't need medication immediately, they will always tell you the same thing: stop smoking, lose weight, clean up your diet, get some exercise, avoid stress, cut out the salt, and come back and see us in a week or two. But if everybody did all of those things, we'd manage to cure many, many cases of hypertension without ever needing to rely on these medications that people go on. So, I think one of the things we've got to look at in healthcare is what systems can we put in place that will help empower people to make these positive, healthy lifestyle choices that are proven to naturally improve our health without any side effects.
And are you looking into this, or are we looking into this enough? Do you think that's something that we're not looking into, or?
I think people are starting to look into it. I'm really enthused to see a lot of doctors coming and talking about it more, with the rise of things like lifestyle medicine, and looking at root cause analysis of what we're doing with our health, and how there are very real situations that people are actually managing to reverse many medical ailments without the need to see doctors. I think that's tremendous, and I think it needs more support and more attention.
Yeah, I mean, just having this discussion and sort of getting the airwaves and being accepted amongst medical professionals that lifestyle is a force to be reckoned with does make a big difference.
It does. I mean, basic biology principles, if it's not genetic, it's lifestyle. What else could it possibly be? It's got to be lifestyle. So, a lifestyle problem also needs a lifestyle solution. And that's really the
as you said, genetics can change. So you've got the epigenetic aspect of genetics as well, where you can switch on and switch off genes.
Yes, we've got a background mutation rate of 1 in 100,000 as well. There's always that to be remembered. But, we can't necessarily directly influence that. We can always influence the lifestyle choices we're making.
And you've gone into the corporate sector as well, because you're doing work with. You've got the health studio that you're working
Yes, the Health Studio is my organization. The work I do in the corporate sector is along with the World Health Innovation Summit, where we're taking healthy workplace initiatives into organizations and actually looking at what they're doing to support their employees with their own health and wellness, and what more can be done to help support that. And that's a really powerful program that we've put together very recently. Actually, I had a meeting this morning with my colleague Daksha Patel, who's helped to co-create the program that we're using. And yes, there's a lot of evidence to support health and wellness within the workplace, and I think wellness is kind of an overused word. I'm seeing it everywhere nowadays, and even I'm getting sick of seeing it. But really simply, what does it mean? It's just about being in a state of health. We've already defined what health means, and I think what's really important to note is what wellness can do for an organization. Organizations, they don't need wellness. It's about whether they want it. And that's the message I try. So I never sort of push this on anyone saying you need this because of these reasons or that reasons. My question really is what do you want? There's scientific literature in the American Journal of Health Promotion, the Economist Intelligence Units, and Humana that have given some incredible stats to support workplace wellness programs, including a 27% reduction in sick leave, the 67% increase in morale and engagement, 45% improved employee retention, 89% increase in happiness and well-being, and most significantly, a 581% return on investment. So this is what we try and push with the World Health Innovation Summit, is that this is not an expense; it's an investment into the wellness of your team, because you take care of them, as Richard Branson says, they'll take care of the clients, and it's really important to make sure that employees, team members, have their health and wellness needs met, so that they're able to go out there and perform at their best and really add as much value as they can.
And it's looking at that holistic approach as well. It's an organization and individuals within an organization. It's looking at individuals as well as the organization as a whole. Yes, and the argument I give is we don't need to make wholesale lifestyle changes across the board with individuals or with organizations. It's really simple. What are the low-hanging fruits? What 2 or 3 changes could be easily implemented into a lifestyle of an individual or an organization that will just have a domino effect on everything else? And it can sometimes be as simple as healthy snacks instead of pastries on coffee stations, or it can be group activities in the evenings. There are various different things and different measures that people can take to support that, and so it's really a matter of just finding 2 and 3 that they can stick to, see how they go over a few months, measure and review. Cool. We're coming towards the end of the podcast. If people want to get hold of you, how's the best way to get hold of you? How can they contact you? Okay, so they can reach me through my website, thehealthstudio.net. I'm active on LinkedIn, so that's under Dr. Shan Hussain. They're probably the 2 easiest ways to get in touch with me. Cool, excellent, and we'll put some notes about the show on the website and all of the links to Shan's details. I always like to ask a question at the end about yourself. So what would you tell yourself, the 19-year-old Shan about to go to medical school in London? What are the 3 top things you'd tell him today? Okay, right, great. Thanks for that. So the first thing would probably be stop worrying about what people might say or think or believe about you. Ultimately you can never control what other people are going to say or think or believe. That they're going to do whatever they want and say whatever they want. Just stay focused on being authentic and being who you are and working on what it is you want to do. That would be the first thing. The second thing that I'd say would be
stop eating so much crap. I was particularly unhealthy at that age, and start to eat healthy and make sure that you're taking care of your health and your wellness, because that obviously makes you in a stronger position to deal with everything else that you have in life. And there was a tremendous amount happening at that time in London back in 1994. It was a great time to be there. There were a lot of wonderful things happening, but it was also very overwhelming. The third thing I would say would be make sure you're taking some time out for you to look after you. Do things that you need to do to relax, de-stress, unwind. And the most powerful thing that I've been doing over the last 7 or 8 years now on a regular basis is practicing meditation. I can, detach, de-stress, release, unwind, and become present, centered, and grounded. And it allows me just to really sort of get into some stillness while crazy things are happening all around the world. It puts me in a position where I can actually be ready to embrace that if I need to. So they'd probably be the top 3 things.
Cool. That's absolutely excellent. That's going to make a lot of people sit up and think about where they're going at that young age. Great, Shan. Well, thank you for your time today. It's been absolutely wonderful, really insightful, and looking forward to more books from you. Thanks, Shan.
You're very welcome. Great to talk to you.
Thank you. Well, thank you for listening, everyone, and looking forward to you again having your spirit surgically not removed. Okay, guys, take care. Have a good day. Bye-bye.
Thanks for listening to this installment of the Surgical Spirit podcast. For all the latest in the world of surgical spirit, don't forget to follow on Twitter at The Third Eye Doc, and catch me on Facebook at the page The Third Eye Doctor. You can visit the website at www.thethirdeyedoctor.co.uk for more information on the work that I do. And please send us feedback and questions and suggestions for the podcast. It's always a pleasure to hear from you. I've been Dr. Haidar Al-Hakim, and I'll see you next time.